early on, we didn't see the metrics because they weren't clear. But as we got curious about best practices within CHP, best practices elsewhere in the industry, or best practices even outside of healthcare, it became clear that many of these could become metric-driven, which brought a honing in and a clarity of direction, and then allowed the right conversations through polarity management as to how do you get there. It created a sense of curiosity within CHP, which I think was extremely healthy.
If we look at certain metrics such as those that describe treatment for congestive heart failure or for pneumonia or many others, what we find is that through the introduction of scientific-based evidence medicine, that if we apply that wisdom to the treatment of our patients, we are in a more predictable way able to bring about better outcomes for our patients, which is really at the core of our mission, at the core of our business.
One example of how our organization benefited from the use of evidence-based metrics is in the area of care for the newborn, specifically the performance of circumcisions. There are clearly stated evidence-based metrics that prescribe proper pain control for infants undergoing circumcision, and I'm proud of the fact that in our organization we identified those evidence-based metrics, we took them through the appropriate medical staff and board quality committees, and very recently we upheld the expectation and the standard that those evidence-based metrics will be adhered to 100% of the time, and they have been upheld 100% of the time. One more example of where we're now proud of the highest level of care that we're providing to our patients.
We have found that by introducing best practices, evidence-based medicine within all of our regions, we've been able to produce, in a very short period of time, phenomenal results in terms of the way that Catholic Health Partners measures up against the national core metrics for quality.
Well, at CHP we use lots of metrics because that's what how we measure our progress and our success. And so we have a whole scorecard of metrics with CarePath so that we know that we're moving forward, that we're delivering safer care, better care, more efficient care using the system.
It's important to realize that the metrics are based not just for the point of view of having metrics, but because they will ensure that we're successful. So one of the common metrics that we use is the CPOE percentage, the computerized physician order entry rate. And I think one of the things which we know going into this is that we need to make a system that the physicians use. If we don't have a system that the physicians are utilizing, we won't be successful. We won't reach that ultimate goal of better caring for our patients. So that is a metric we know directly relates to how well they're using the system and how well the system is being utilized across the board.
One of the metrics that we're really following with CarePath is the use of the barcode med administration, because we really want to reduce drug errors, and so we're tracking drug errors before and drug errors after use of the system.
Having metrics enables us to manage with confidence when a problem is not fully solvable, but yet we're managing through two polarities. So for example, in the workplace, if we need to achieve high levels of efficiency, but we also value associate engagement and satisfaction with one's workplace, we can neither drive efficiency to the point of personal dissatisfaction with the job, nor can we expend resources so that everybody's happy all the time, but we're quite inefficient. Metrics help us know whether we have struck the right balance. We can look at employee engagement scores, and we can look at our efficiency metrics and see if in aggregate we have struck the right balance.
We use evidence-based metrics in just about all aspects, in just about every discipline of our organization. Another example that comes to mind would be in human resources. We have metrics where we look for what the rate of employee turnover is. And again, our desired outcome is we want to reduce the turnover whenever possible in our organization. And by measuring our performance to like organizations, it has been very helpful to us to identify opportunities for improvement, and we're very proud of the success that we've realized as we've seen our actual data improve favorably compared to national statistics.
What it really boils down to when we take a look at what our mission represents. Our mission is a collective result of our metrics.
It takes more time to look at multiple points of view. It takes more time to have a regional board and a system board. It takes more time to bring the regional leaders together with the system leaders. But once coming together, we learn from each other, we get different points of view, we make better decisions, and that's why the metrics are important, because they demonstrate that by doing it this way, we serve the community better, we have better quality, and we're more efficient.
Catholic Health Partners has been a metric-driven organization certainly since I became a part of it. And that set of metrics has helped drive us to, I think, one of the leading organizations in this country when it comes to delivering care. And in fact, I think that's been validated by a number of sources, not the least of which is Thomson Reuters.
The recognition itself is very nice to have, and I'm gratified on behalf of our caregivers that their work has been recognized. But that's not really what's important. What's important is that our patients every day get the care that they need according to the best evidence available at the time. And our communities know that they receive value for their healthcare dollar. I firmly believe that if we had not adopted a philosophy of practicing based on evidence and measuring our performance using objective data over a decade ago, we would not have achieved that recognition.